For my presentation, I was given rheumatoid arthritis. So rheumatoid arthritis is a systematic autoimmune disease. It causes inflammation of the joints and erosion of the bones. It's most common in females and in like the geriatric population, the older population. And it has episodes of activity with periods of remission. So you can go a long time without having like a flare-up or anything like that, and then all of a sudden you have one. And it kind of looks like this, like in these pictures, how it shows the swelling of the joints and the synovial fluid around the joint. The etiology. Rheumatoid arthritis is thought to be partly caused by genetics. A lot of, like, it's passed down from, like, if your mom has it, then you could have it, or if, like, your dad, it's just passed down. Environmental factors like smoking is a very big one that came up a lot in my research, and, like, obesity that can help cause rheumatoid arthritis. And in the past, it's been linked to delayed wound healing. Like, it causes delayed wound healing, but also can originate from delayed wound healing. So when you have like a wound that gets infected or something like that, then it is more likely to cause rheumatoid arthritis. The signs and symptoms: inflammation of the synovial membrane. So you can kind of tell, like on your fingers, you'll be able to tell when your joints swell up and there's a lot of pain involved in it. Early morning joint stiffness is another one that happens quite often, and fatigue and fever. This chart just shows like some of like the areas of where like symptoms will be when rheumatoid arthritis is present. So you could have like disrupted sleep, fatigue, depression, and it says like your dry eyes and mouth also. Weight loss, you can will be present when there's a flare-up. Numbness and tingling in the hands, and your joints will feel warm to the touch because of the swelling. And your joints will also look different. They'll look red and discolored. Diagnosis: rheumatoid arthritis is extremely difficult to diagnose in the early stages. There's no like blood test or like physical test really to diagnose it. It's usually diagnosed during a physical when a doctor is checking a patient's joints. So it's very hard for a doctor to be able to diagnose. There's no cure for rheumatoid arthritis. Medication and physiotherapy can slow the progression of the disease. So like non-steroidal anti-inflammatory drugs. There's also a lot of self-care that goes into it, like heating pads, like hot showers. Mainly just apply heat rather than cold to relieve the pain and the stiffness. But there are like some medications, but none of the medications will cure it. They just help with the symptoms. Prevention, so you need to reduce environmental factors, so like smoking, your eating habits, so like weight loss is a very big one. Get help early, like if you suspect that you have rheumatoid arthritis or that your joints are hurting, don't be scared to make a doctor's appointment, and just get it checked early. And then limit your exposure to like pollutants, so in the air, in your water, just everywhere. Prognosis: it can take 10 to 15 years off of a person's life. However, some people live up until their 80s or 90s with it. Lifestyle can affect prognosis. So if you're living a healthy, active life, like you're more likely to live up into your 80s or 90s. But if you don't take care of it and you just let the stiffness and pain continue, and you smoke and you don't lose weight, then that'll affect your quality of life. It'll impair a person's quality of life because they're not able to use their joints like they normally would. CNA cares. So as a CNA, you can assist a patient with their daily activities, like getting them dressed, their morning care, helping them walk, helping them eat. And we can also help to relieve symptoms using a heat compress. We can apply the heat compress and be sure to check it, but also prevent patient from getting pressure ulcers. It's very hard on the joints because they're so swollen and they're just more prone to pressure ulcers, so we can help with that. And then my references.